closed chain shoulder flexion, arms straight on a foam roller. Aim of exercise: improve range of shoulder flexion with a cylinder. Create fine neuromobility. Instructions: toes face downward, elbows are straight, back is straight, and when the sternum moves downward, the neck is in extension and the wrist in dorsiflexion. Main points: feet are parallel and wide apart. Back is straight and elbows are straight. While holding position, gently tighten the abdominal muscles to stabilize the lower back and direct breathing to the rib area.
Focused thoracic extension and pectoral stretch mobility and massage on a foam roller. Aim of exercise: make chest muscles more flexible and improve range of thoracic vertebrae extension. Mobility of the shoulder girdle and upper back using 2 poles and a fit ball. Aim of exercise: improve ranges of movement in the shoulder girdle and stretch the chest muscles. Instructions: fully round the back while moving the torso forward and rise with the back straight, elbows flexed, and bring scapula close together. Main points: after a number of repetitions, hold the forward stretch with an emphasis on segmental straightening of the thoracic vertebrae. Spinal mobility in the coronal plane with a pole. The aim of this exercise is to improve mobility of the thoracic vertebrae and make the chest muscles more flexible. Instructions: move the pole up and behind the scapular line and in contact with them. Maintain the pole in a line parallel to the ground and move the torso from side to side while maintaining the pelvis stable in the midline. Main points: feet parallel and knees point forward. Strengthen the erector spina muscles using chair and pull. The aim of this exercise is to improve thoracic mobility, make chest muscles more flexible, and strengthen the deep erector spina muscles. Instructions: hold the pole while rotating the arms outward, lateral rotation. A. Inhalation. Straighten the back, chest prominent in front, and maintain lumbar lordosis. B. In this position, hold in the abdominal muscles and tilt the torso forward while holding the pole close to the pelvis. C. Disconnect the pelvis from the chair, raise the pole, hold this position for a few breaths, and return slowly to the chair. Main points: A. Feet parallel and spread wide. B. Throughout the exercise, gently hold in the abdominal muscles to stabilize the pelvis and lower back and direct breathing to the rib area. Focused thoracic extension using pole and large ball. Aim of exercise: develop motor control of thoracic vertebrae mobility, strengthen core and erector spina muscles, and stretch chest muscles. Instructions: place the pole behind the scapula and hold it facing the elbows. A. Exaltation: fully round the back with forward flexion. B. Inhalation: straighten upper back while pressing the pole downward and return gradually to the starting position sitting on the ball. Main points: A. Feet parallel, spread wide. B. During the holding stage of the exercise, lightly hold in the abdominal muscles to stabilize the lower back and direct breathing to the rib area. Thoracic extension with pole while standing. The aim of this exercise is to strengthen the erector spina muscles during focused thoracic extension. Instructions: descend with rounded back and while raising, hold the position for a short while with back straight and parallel to the ground using a pole for assistance. Back is straightened by recruiting the abdominal muscles and pelvic floor and maintaining spinal curve alignment in the neutral position. Main points: implement the isolation to integration principle in the drill to emphasize thoracic movement. A. Focused straightening of the deep erector spina muscles in the thoracic vertebrae. B. While holding the position, hold in the abdomen and direct breathing to the chest cavity area.
Chair pose, Utkatasana. In this pose, we must activate the core muscles and stabilize the load-bearing body. In addition to its use in yoga exercise, the pose works on a basic, very functional movement pattern that is essential in many daily activities as well. Regular practice of this movement helps to strengthen the thigh muscles and improves control of body stabilization. While in this position, we will emphasize the use of the stabilizing core muscles, holding in the pelvic floor muscles and the transverse abdominal muscles. Not using the core muscles will cause instability of the lumbar spine and a high load on the lower back. The pelvic floor muscles contract as part of the core muscles to maintain intra-abdominal pressure.
Sit or stand with your torso straight and your spine lengthened. Pull your right shoulder away from your ear. Slowly tilt your head to the left as far as you can. Hold the position for 10 to 15 seconds. The main muscles that are stretched are the scalene muscles and some of the upper trapezius fibers and the levator scapula. The first movement to perform is neck flexion, bringing the chin to the chest. This movement slightly stretches the neck extensors and the levator scapula. The stretch can be deepened by taking the head to the side opposite the one you want to stretch, which will also stretch the trapezius. You can use your hand to add a light load to the head and to stretch these muscles a bit more. Some of these muscles are small and delicate, and therefore be careful when stretching them. Neck extensors stretch. We stretch the neck extensors by performing neck flexion. The action is performed by activating and contracting the neck flexors. Sit on a bench, keeping your spine lengthened. Pull your shoulder blades down your back, and then lean your head forward while keeping your torso lengthened. Hold this position for about 15 seconds. The muscles that are stretched are the group of superficial and deep neck extensors. Among those being stretched are the upper trapezius, the levator scapula, and others. The origin of some of the muscles is the scapula, and therefore it is possible to increase the stretch by actively lowering the scapula.
Sit so that your torso is straight. Tilt your head backward, then tilt it to the side as far as you can. Cervical extension C2, C7 with lateral flexion.
Among the muscles that are stretched are the sternocleidomastoid, longus colli, and longus capitis. Moving the head to side flexion increases the stretch on the opposite side. Anterior deltoid, pectoralis, and biceps brachii stretch. Stand with your back straight and elbows straight. Join your fingers behind your back with your thumbs facing down. Now move your arms away from your back while performing a shoulder extension until you feel a stretch in the front of your chest and arm. It is important to keep the back straight and the elbows straight for maximum stretching. The main muscles that stretch around the shoulder are the anterior deltoid, pectoralis. The biceps brachii is also stretched in its proximal part, but in the distal part it is loose because the elbow is in a neutral position. To increase the stretch of the biceps brachii, you can pronation the hand by turning the thumbs outward.
Contract the triceps to extend the arm further. This action signals the biceps to further relax via reciprocal inhibition, deepening the bicep stretch.
Deltoid, pectoralis, and biceps brachii stretch. Stand with your back straight